In this video, you can hear discussion about ways to be aware of and avoid dangerous internet pharmacies.
So I'm in Prague at the 2017 EACPT Congress with colleagues from a session on global health related to access to safe medicines. And can I start with you, Mike Isles? You've been talking about the scale of use of internet pharmacy and the range of products. Would you say a bit more about what people are doing and how many across Europe are using the internet to access medicines?
It's a fact that it's a rising issue in that more and more of the public are going on the internet to buy goods and even medicines now. And a survey revealed that 18% of the European population, okay, it varies from country to country, but 18% translates into 130 million people. But it just demonstrates it's a very big number, and it's a rising threat for public health across Europe and, of course, across the world, ultimately.
What range of medicines are people trying to access?
I think we have to dispel this myth that it's just lifestyle medicines. It's not. The MHRA, which is the UK medical agency, was involved in this pan-European, pan-world investigation per year, where they apprehend packages on borders across Europe, and they discovered 63 different types of medicine. So it's oncological products, it's antibiotics, it's cardiovascular products, it's everything. So we must dispel this myth. It's all sorts of medicines are being falsified by criminal networks.
And as I said earlier, Jozef, there are many concerns amongst patients as to accessing medicines and their health, and that's one of the reasons they go to the internet. Would you say something about European policy to try to make sure that medicines are available across the European region for all patients in conventional ways?
Well, interestingly enough, the problem of access to safe and effective medicines is not the problem only of so-called low or middle-income countries, but also for the so-called high-income countries, because of the differences in the populations of these countries. There are some population groups, even in the rich countries, that are very much underserved. And the problem is really popping up everywhere, and it's growing. So it's clear that the wise pan-European or even the world global policies are necessary. So it's a good thing to see that noble institutions, global or European, stepped in already and are doing their job. Of course, this is not enough only to have good policies on paper. It's also important to have them implemented, and this is the role of policymakers in all countries. It is also important to come together as countries to have more weight in difficult negotiations around these issues, really to provide for your people, for your patients, the safe and effective medicines and not the fakes. And we see also the role of clinical pharmacologists in all these important and complex professional and even scientific issues that are to feed the policy decisions here and there, and really make a common front to really attain these sustainable global goals of providing more health and more life to our citizens in Europe and elsewhere.
Pavle, so we've heard about the internet. It's been used very widely. Would you say something about the scale of criminal misuse of internet pharmacies and what's been done to try to coordinate nationally and internationally to try to resolve this?
Yes. The internet, by the data provided by the WHO, provides more than 50% of falsified medicines, and this danger can affect all different age groups. We are particularly worried about the young, and of course, the national authorities have been doing a lot, but the international community had to do much more. And we, of course, have in the EU the Falsified Medicines Directive, and on the Council of Europe level, the Medicrime Convention, and many other practical solutions how to prevent and to make a big difference between the legal online pharmacies and the rogue ones that provide dangerous fake meds. So what needs to be done is first and foremost the education of the patients, but also the healthcare professionals who must use their position to ask the questions to the patients, and we did this in the panel today by Mike, and also to take a more proactive role. Everybody has to do much more in order to prevent these type of activities, because this is where the criminals take their particular interest. And even though there have been some cases of entering the legal supply chain, most of the fake medicines appear online and without proper control by the regulatory authorities.
And would you say something about the Medicrime initiative?
Yes, the Medicrime Convention was open for signature in 2011, and it's the first international treaty developed by the Council of Europe that is open to signature not only to member states of the Council of Europe, the 47 European countries, but worldwide, and it has been signed by 18 countries and ratified by 9 so far, and it enables the countries to change their legal and penal systems, and to further enable international cooperation by establishing a single point of contacts network. And also a lot has been done in the terms of training conferences, and of course in terms of enabling countries to understand the seriousness of the problems by introducing, for example, the similar crimes that were first developed by the Medicrime Convention and defined more specifically in this text.
Thank you all very much indeed. Pavle, what can be done to educate the young?
Yes, of course. So this is a big question. We need to do to be more original. We did a very good campaign with a cartoon based on the issues raised by the Medicrime Convention, the Open Minds, Free Minds comic book, which has been also an interactive game. So we are using the technology that is accessible and interesting to them. And we did a huge campaign with more than 10 countries participating, even in Africa, that had great results and a big media coverage. So we think that this is a good approach, and of course many countries are using also very original and innovative tools, very modern tools, how to change the perception, not only to educate, but to really make these young people grow into responsible adults who take good care of their own health.
Mike, how can somebody looking at a website for internet pharmacy tell that this is an authentic website? What systems are in place at present?
Well, clearly it's not that easy, because these websites look absolutely authentic. Within the Falsified Medicines Directive, then each member state is now obliged to register pharmacies, and indeed retailers where the law allows, and that on each of the website page advertising a medicine, there is a common logo with the country flag on, and when the visitor to that page clicks on it, it goes through to a registry of registered pharmacies and registered retailers. That's all very well. That link is encrypted. However, the criminals are already cutting and pasting the common logo onto their criminal websites. So whilst we believe this is it's a good initiative for sure, that will help, educate the public about what is a proper website to go to. But in addition, we are very much involved with a .pharmacy initiative. This is called the top level domain name. Rather like you have .com or .org or .net, then the National Association Boards of Pharmacy have bought the top level domain name .pharmacy. That will be incorporated into those pharmacies that want to use that .pharmacy URL. And if you and I know that if we go to a website that finishes its URL with .pharmacy, it cannot be forwarded in any way. And so what we need to do is to get more and more pharmacies on board to adopt the .pharmacy. And that's what we're also trying to do. And that in turn will help another measure, a complementary measure to the common logo, to help protect patients be safer when they buy their medicines online. One simple rule of thumb though, if I was to tell somebody to look for, to ascertain if it's a fake pharmacy website, if you don't need a prescription, it's operating illegally.
Jozef, thinking about different steps along the route to recognition and prevention, what sort of simple suggestions would you have?
Well, these are not that simple suggestions, but the first thing is that the patient trusts you and that he or she will reveal what really is or she is doing for the sake of his or her health. So this is the first point. This is the question of communication, to get the communication right. And then, because it's an increasing problem, you have not to forget about that in your differential diagnostics and in really communicating the patient what to do, what his therapy should look like, and also to warn him or her not to use these various food supplements unwisely or any other phytotherapies and other things that might be even detrimental for his or her health. Unfortunately, patients are not much aware about these dangers and risks they are taking in a good faith. So we have to do a lot more in education. In Slovakia we have several already initiatives building upon the EACPT project. This was a European project. EACPT stands for the European Patients Academy on Therapeutic Innovation. So we already have a Slovak branch of it, and we organize courses for patients representatives. We have a lot of informal initiatives in media. We started just a few days ago the Vice Use of Medicines initiative. This is a huge program. The opening press conference briefing will be next week with the participation of the Minister of Health and other stakeholders. So we are looking very much forward to collaborate with patients, because this was patients' initiative at the beginning, and I'm honored to be the professional guarantee of this initiative. So I think we could really do a lot in a good faith with not a lot of money, but with a lot of good effort.
The proceedings of this session on access to safe medicines will be published in the journal Clinical Therapeutics, the official journal of the EACPT. Our next Congress will be in Stockholm in 2019. See more on our website.